So this is Zohir Chaudhary, and today we will focus on indicator-based and event-based public health surveillance systems. These are, especially the event-based public health surveillance system, is a new type of surveillance system, which we'll definitely introduce a lot more later. But in here, we'll compare the two types of system against each other to understand how they overlap and how they vary. So the spectrum of public health surveillance can be categorized depending on the data collection method. We talked about passive and active, target population coverage, whether it is population-based or sentinel-based, the case by the distinguished by the case definition, the case distinguished through laboratory-based surveillance as well as syndrome-based case definition, which is syndromic surveillance. And then the focus right now is distinguishing by the source of the data and the structure of the data. So indicator-based surveillance, IBS, or event-based surveillance, EBS. And of course, there's significant overlap between all of this surveillance systems. So event-based surveillance, or EBS, and indicator-based surveillance, or IBS, both strategies are fundamental to a comprehensive surveillance system, and each has different goals with some overlap. So what is indicator-based surveillance? Indicator-based surveillance is defined as the systematic collection, monitoring, analysis, and interpretation of structured data, indicators, produced by a number of well-defined, predominantly health-based formal sources. So the structured data are the indicator, and this is why it's indicator-based surveillance. On the other hand, event-based surveillance is an organized and rapid approach in capturing of information about events that are potential risk to public health. This information can be rumors and other ad hoc reports and can be transmitted through formal channels as well as informal channels. And the formal channels are typically the established routine reporting systems. And this is where some of the overlap happens with indicator-based surveillance. And the informal channels are the media, internet, community workers, non-government organization reports, and other website-related information that is available for gathering information. The International Health Organization expands usual infection disease notification to include surveillance of public health events from various origins. And by various origin, we mean nuclear, chemical, or unknown origin, and prompt member states to develop the capacities for their surveillance systems to detect, assess, notify, and respond to all acute health events or health risks that may constitute a threat to human health. So in this regard, the International Health Organization 2005, IHR 2005 notes to comprehensively meet the early warning and alert (EWAR) requirements of the IHR, there is a need to strengthen and develop both routine or indicator-based surveillance and event-based surveillance. So IHR introduces both terms in here, indicator and event-based surveillance, and we will see how the two overlap and the need for both. This is a visual comparison of indicator-based surveillance and event-based surveillance. On top, we have the indicator-based surveillance, and we can see how the typical surveillance system, you have public, someone ill with a condition will go and see a clinician or approach public health workers, and they'll be able to capture the information, and the information will be transferred through notifiable or reportable reports and forms through local officials, which in turn it will be transferred to central health agencies or national agencies. At the same time, labs will also be able to analyze specific information and transfer that to central health agencies. In terms, the central agency, depending on what's going on within their jurisdiction, they'll transfer to WHO at the international level. So this is the typical indicator-based surveillance system that WHO was talking in the previous slide. The event-based surveillance system, on the other hand, you have this grouping as shown in here, where you have a combination of all of these sources, laboratory, clinician, public health workers, including the general public, local officials, central health agencies, as well as WHO, or in addition to all of this, just the media in general can also be a source of information that will be constantly gathered in this event-based surveillance system. So this event-based surveillance system captures information directly from all of the sources. And so it is, of course, overwhelmed with a lot of potential signals of public health potential public health event that can become threat. So those all of the signals, all of this data has to be triaged and verified. And this process of triage involves sorting of data and information to discard duplicates and to exclude disinformation, irrelevant information, and false information to identify the real events. Once triaged, the verification step confirms the authenticity of the signal and stimulates additional collection of information. Once the signal has been triaged and verified, it becomes an event. So here we can see in this picture that once it's event, a risk assessment is done to understand the potential economic impacts, food security impact, or other impact to the nation. And once a risk level is assigned and assessed, the appropriate level of investigation, response, and control measures can be determined and provide an action. And in this chart, we can see the various types of signals that event-based surveillance would call it a signal. So different signals from the community are listed in here, a subset, different signals from health facility, different types of signals from laboratory, as well as from the animal sector. And then, of course, a whole host of signal that can come from the media, etc. Essentially, you're really looking at potential health events that can pose threat, and you want to identify this before they become a big threat by capturing all of this information as shown in here, and this is known as the signal. Here is an illustration of an hypothetical scenario where signal for an event of a cluster of cases due to a novel respiratory virus are detected through different sources. So in here, we can see to this EBS system. In this hypothetical scenario, the early warning can come through several sources. So, for example, source one can be a community health worker at the local level, or a key informant receiving information about 3 residents of the same neighborhood who are severely ill, and 2 of them rush to a hospital with severe respiratory illness. So that could be a signal. Our source 2 could be a hospital at the local level, at the community level, and a hospital receiving 2 severely ill patients from the same household in the emergency unit, and that could be a signal. Or source 3 could be in the animal health sector, where a sudden sickness and death of poultry in a community and in an animal market can be the cause of a signal that can be gathered. We can also see, for example, at the national laboratory detecting an unsubtypable influenza virus from hospitalized patient. That could be a signal. Or the media itself, like through news outlets, internet outlets, social media as well, where reports of increasing public anxiety over a number of hospitalized cases from one municipality can become a signal. Or it can be a school reporting several children that are absent due to severe respiratory illnesses through their school absenteeism reports. There could be surveillance expert finding an increase in the number of cases of suspected dengue over the alert threshold. So all of this potential signal can all be fed into the system. And once the signal comes in, it will be triaged for verification. And once the event is verified as a suspected cluster of severe respiratory illness, response mechanism will swing into place with coordination across sectors and quick intervention to save lives. And this is how like an EBS system would work. So now, comparing the indicator-based system against event-based system, we can see that the IBS system usually focuses on known diseases, whereas EBS system usually takes on an all-hazard approach and can report on both known and unknown diseases. The IBS system detects disease outbreaks and characterize disease trends and patterns, whereas the EBS surveillance system detects health events that can potentially pose a serious risk to public health. In the same token, IBS relies on structured information, whereas EBS on unstructured information, such as including both verified as well as unverified sources through rumors, claims, and stories. The data sources in an IBS system are from health system infrastructure, such as clinical records from community hospitals or laboratories, whereas the data in an EBS system can come from official sources as well as news media, publicly accessible social media, and other online media sources. And finally, an indicator-based surveillance system outputs indicators or measures related to a particular health issue, whereas an event-based surveillance system outputs early warning signals of new emerging and reemerging threats to public health. Here are some examples that can be classified under IBS or EBS, depending on the type of information and specific source of information. And you can see there are 3 examples, and I'm going to go over maybe 2 examples. So example 1, the central pharmacy reports to the health authority that the sale of anti-malarial drugs in non-endemic areas has exceeded the normal pattern. So there's a reporting going on in here, whereas in an EBS system, a local pharmacy mentions to the local health authority that the pharmacist is facing a shortage of anti-malarial drugs, a medication seldom sold in the shop due to increased demand. So that can become a signal in an EBS system, and this is more like an unstructured source of data. Another example, it could be where in the scope of the National Zoonosis Control Scheme, the National Veterinary Service reports the occurrence of influenza A H5N1 influenza in a large commercial free-range broiler flock. And this would be data source for an indicator-based surveillance, like a traditional surveillance, and an event-based surveillance would capture the data where maybe unusual die-off of birds is reported by local farmers raising backyard chickens, and this would raise a signal of concern that needs to be investigated and triaged, and so forth. Here we are depicting how WHO integrates the event-based surveillance system, which is an innovative process, a next generation surveillance system, into the more traditional indicator-based surveillance system, which is already existing in most countries, in all developed countries and in most developing countries as well. So the event-based surveillance would overlap in some aspect with the indicator-based surveillance to provide early warning function, whereas the indicator-based surveillance would have the other surveillance functions that are typically monitored at the national setting. Here you can see the types of input, the process, and the output of this combined system that WHO calls early warning and response system, where both event-based surveillance and indicator-based surveillance are integrated together. Another depiction of this WHO surveillance integration can be seen in here. You can see the IBS and the EBS with a little bit of overlap, and then the specific characteristics of data and the specific process, the input that goes into the system and the different types of input, and then finally how combined together it provides epidemiological intelligence that needs to be properly assessed into an early warning and response system. So that's how these two systems works together. And I hope that it was useful for all of you to learn about these new types of surveillance system. Thank you.